everyone, this is Marinel Imiras, and for tonight's live video, I will be doing my patient's musculoskeletal assessment. Now, the first thing that we need to do before any procedure or assessment is to do hand washing for infection control, okay? So let's say that I am now doing my hand washing, okay? So, knock on patient's room. Hello, sir. Good evening. May I enter? Okay. So, my name is Marinel Imiras. I will be your student nurse for today. Would that be okay with you, sir? Okay. Now, can you please state your name so that I could verify your identity, sir?
Clem Joseph
Lens Joseph. How about your last name?
Minas,
Okay. How about your birthday?
March 11.
Okay, very good. Now, sir, for tonight, we will be doing your musculoskeletal assessment. So we will be examining your muscles and your joints. Would that be okay with you? Now, the purpose of this assessment, sir, is for us to detect any musculoskeletal dysfunction and also for us to provide or plan for proper intervention as well as to teach you on health promotion and disease prevention, okay? So before we start, sir, would you like to empty your bladder first? Ganahan ka manghihi sa daan?
Euro,
Dili lang. So I will now be closing the door and providing you with a privacy. Okay? So I will be closing the window as well in here. Okay? The next thing that we will be doing, sir, is that I will be assessing your posture, your gait, and your cerebral function, okay? Would that be okay with you? Okay, so can you please stand up, sir? Indog lang ta. Okay, stand up. Okay. So patient's posture is normal. It is straight. Very good. I will be screening for some symptoms of lordosis, sir. Can you please stand here in the wall? Okay, very good. No signs of lordosis. Now, can you bend your body here so that I could check for scoliosis? Okay, so the spine is in the midline of the body. It did not destruct or it is not displaced to another direction. Very good. Now, the next thing that we will be doing, sir, is that we will be checking for your gait. Okay, so can you walk for me? Lakaw. Kanang tarong nga nilakwan, sir, how you usually walk? Okay, balik pa ingon dito. Okay, so our patient's gait is normal because his arms and his legs are coordinated. The next thing that we will be doing, sir, is that we will be checking for your knee deviation, okay? So I will be using my measuring tape in here. This is our imaginary line. If your patella is intact within the line. Okay, very good. Patella is part of the line or in very good. So here is your patella. So naigo siya, sir. Okay. Next thing that we will be doing, sir, is that we will be checking for your cerebral function. So I will be asking you to do some tasks and you have to do it properly and do it kanang tinarong, sir, okay? So the first thing that we'll be doing, sir, is can you do Romberg test? We've done this before, wherein you will be closing your eyes and placing your arms to the side. Okay, close your eyes. Very good. Now I will be applying resistance. You have to attain balance. Okay, very good. So we are negative in the Romberg test. The next thing that we will be doing, sir, is your rapid or RAM, rapid alternating movement. Can you please sit down? Okay. So do as what I say. So this is what we call, sir, pronation. Okay, this is what we call pronation and supination. Okay, can you do pronation, supination, tap pronation, tap supination? Supination. Okay, very good. The next thing that we will be doing, sir, is your finger thumb. Like this one. Can you do it? the other hand. Okay. Okay, very good. Next thing that we will be doing, sir, is your finger to finger. So can you touch my finger using your finger? Okay, and the other side. Again. You should be touching this side, okay? Are you having difficulty touching my finger? Again, again, again. Very good. Very good. Next thing that you will be doing, sir, is the tandem walk. You know how to do that? The tandem walk, the heel walk, and the two walk. Okay? So this is how you do your tandem walk. Follow me afterwards, okay? Tandem walk is using both of your left and your right legs to walk, okay? Walk in line, okay? When we say heel walk, sir, we will be using your heels, okay? And this is our heels, okay? So walk in line, okay? Copy. And for two walk, we will be using our toes, okay? This is how you do it. Okay, can you do it for me now? Tandem walk, atong duha ka tiil, sir. Okay, 3, 2, 1. Again, again. Again. Okay. Very good. Arms and legs are well coordinated. The next thing, sir, is do heel walk. This one. Heels. 3, 2, 1, go. Are you having difficulties? Lisod i-balance? Dili lang. Okay. Next, sir, is two walk. Can you do two walk? Okay, very good. Okay. The next thing that we will be doing, sir, is knee bend. You have to bend your knee. Okay? Bend, like bend. Again. And you have to hop in your place. Like hop in place. Very good. So our findings for that is normal because the movement that I've given or the task that I've given to my patient is portrayed properly and the movements are well coordinated. The next thing that we will be doing, sir, is that I will be inspecting your muscles. So can you please lie down? I will be inspecting for the size, the color, the firmness, if there is any lesions, tenderness, masses, or nodules. Okay, so please higda lang ka, sir. I will be touching you. Would that be okay? So let's start with, we will be starting with our patient's musculoskeletal color, or I mean the color of his skin. So from the neck, going to the legs and the ankles. So the tone of our patient's skin is light brown. It is uniform from the neck to the ankle, as what I've said earlier. Now we will be checking for symmetry. If his upper girdle is symmetrical for both sides, and if his lower girdle is also symmetrical. Okay, so I'm trying to check it. Okay, very good. Now for us to confirm if it is really symmetrical, we have to measure the exact size. So we will be measuring his upper extremities or the arms, and his lower extremities and his legs. So I will be using my measuring tape. The formula for that to determine if it's normal is that it shall be less than or equal to 1 centimeter in the difference for both sides. So I will be measuring from here in the acromion process, going to the tip of the middle finger. So take note of the size, sir, okay? It's 66 centimeter. Pila ganito, sir? 66. Very good. The other side, it's also 66. So both are having equal symmetry. That is 66 centimeters, and we consider that normal. Next is, we will be starting here in the anterior superior iliac crest, going to the medial malleolus, okay? So take note of the measurements, sir, okay? It's 78. 78, am I right? Yes, 78. Here, it's also 77. Pila ganito diri, sir?
78.
The other side?
77.
Okay, so we still consider that normal because that is less than 1 centimeter. 77 and 78. So that is less than 1 centimeter. Pasok yan sa ating formula because less than or equal to 1. The next thing that we will be doing is we will be asking our patient some questions, okay? So, sir, please answer these questions honestly, and the answers that you will be giving to me will remain confidential, okay? Have you had any history of musculoskeletal problems, sir? Like scoliosis, osteoporosis, mga lordosis, wala? Arthritis? How about your parents or mga lolo-lula?
Wala po.
Wala. Are you experiencing any pain? Diri sa lawas ni mo karon na sakit? Wala. How about accident or trauma? Have you been to any accident or trauma that affected your joints and your muscles and your tendons and etc. under your musculoskeletal system?
Wala.
Okay. How about immunization for anti-tetanus and anti-polio?
Wala po.
Wala pa. So, we need or you need to be immunized with anti-tetanus and anti-polio, sir, ha? Because it will be protecting you from musculoskeletal dysfunction, okay? Are you allergic to dairy products?
Di man.
Dili man. Okay, very good. You are lucky, sir. Because some patients who are having lactose intolerance is that they are not sufficient with calcium, so their bones and muscles is not strong. So ikaw, sir, kay dili man ka allergic o dairy products, you have to consume daily products and drink, okay? Next, sir, is that what activities are you doing to promote your musculoskeletal health? What exercises?
Basketball.
Basketball. Okay, I will be stating that here. Duration, sir, mga pila ka adlaw ka within 1 week mag-basketball?
Ikaduha.
2 times a week. How about the time, like pila ka oras or minutes?
30 minutes.
30 minutes. Are you wearing protective equipment when playing basketball?
Wala.
Wala. So when playing basketball, sir, you have to wear protective equipments. Kinahanglan ka magsapatos, magnipad, or unsa pang laing mga equipment gina-use sa basketball, okay? So that you could prevent from any injuries, okay? Next, sir, is that I will be doing assessment of the muscles. Would that be okay with you? I will be assessing for tonicity, for if you're hypertonic or you're hypotonic, okay? I will also be checking for muscular drifts, if nahiwi atong mga muscles, sir, so ato nang i-check, okay? And I will be also checking for your cranial nerves number 5 and number 11. Okay lang?
Yeah.
So first, I will be assessing and palpating your muscles in a resting state. So ayaw lang pangusom, sir, ha? Ada pangusog, ha? Other side. Okay, so in the resting state, my patient's muscle is of course soft, it is also non-tender, and it is pliable. So sir, pwede kang mangusog, do it like this. Mangusog, okay? Mangusog, 3, 2, 1, go. So this is what we call the contracted state because our patient's muscle is contracting. So as I've palpated it here, okay, in this side, sir, pangusog, I will push your legs up, pangusog, ha? Ipa-down imong tail, okay? Pangusog. Okay, the other side. Pangusog. Okay, so in the contracted state, our patient's muscle is of course firm, but it is non-tender. So that is what we consider normal. And the next thing that I will be doing, sir, is that I will be checking for cranial nerve number 5, that is our trigeminal nerve, and cranial nerve number 11, that is your spinal accessory nerve, okay? So can you please stand up? I will be checking for your cranial nerve number 5 first. That is your temporo submandibular joint. Can you please open your mouth? Open it widely. Close. Open. Close. Open. Na-cracks ka nga na-feel? Sakit? Wala. Very good. Next thing that I will be assessing is your cranial nerve number 11, your spinal accessory nerve. So I will be checking for muscle strength. Ang musog, ha? You have to raise your arms upwards, okay? 3, 2, 1, pasaka, go. Again, 3, 2, 1, pasaka. Very good. The next thing that I will be checking, sir, is your sternocleidomastoid. So I will be putting resistance, and you have to face that force that I am giving to you again. Okay, the other side. So here is our sternocleidomastoid. You can see it, that it's properly working. Again. Very good. The next thing that we will be doing is that we will be palpating for any muscular drifts. Can you please sit down? Be checking if the muscle is in the right area. It is also a good opportunity to assess for any skin trigger, and also to assess for or to do capillary refill. So skin trigger, it easily falls back. Capillary refill, okay, it easily goes back to pinkish color. Let me check for drifts on the other side of your arm. Sakit? Okay, so no drifts. And now we will be moving to the range of motion. So we will be starting with the neck, with the arms, with the elbow, with the forearm, with the hands, with the finger, and with the thumb. So I will be palpating this if I could feel any nodules or any masses. Other side. Okay, so no masses and no nodules, no lesions, no edema. Can I check for edema? Okay, no edema. So sir, we will be starting with the neck, okay? Would that be okay with you? Can you flex your neck? You know how to flex your neck? Dungo? Okay? Sakit? Tell me if sakit, okay? Flex it pa. Kaya pang ma-flex down kayo. Okay, extend straight up, hyperflex. Okay, again, flex, palalo, flexion, extension taas, hyperflex. Sakit? Are you experiencing any pain? Okay, so the finding for that is normal, and that is having a full range of motion. Okay, the next thing that we will be assessing is our patient's shoulder. Okay, so stand up, sir. I will be instructing you with the things that you need to do. So for your shoulder, sir, you have to do flexion, up, sakit, straight, up, extend, down, hyper extend. Here, like do it like this. Up, 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 extend, down, hyper extend, sakit. Okay, very good. So our patient is having a full range of motion in his in the joint of his shoulder. The next thing that we will be doing is rotational lateral. Are we done with rotational lateral bending in your neck? Not yet. So let's go back to your neck. Let's do rotational lateral bending in this position, like you are about to sleep. Sakit? Straight lang ang shoulder. Okay, bend. The other side. Are you experiencing any pain? Again. The other side. Okay, do rotation. Look to your left and your right. Okay. The other side. Any pain? No? Okay, very good. Let's go back to your shoulders. Okay, stand up, sir. Let's go back to your shoulders, and we will be doing abduction and adduction. So that is the side. Okay, so can you do abduction? Raise side, side, pataas. If masangit ka, sir, do it sideways. Okay, do abduction, pataas. Okay, pataas, sige pa. Very good. Do adduction, down, palapaw dire, down, anak sir, anak. Up, ow, up, sige sir, up, and down. Palapaw sir, dire sa center sa body, palapaw. Okay, very good. Next thing that we will be doing, sir, is internal and external rotation as well as circumduction, okay? Okay, so when you do your internal rotation, do it like this. Use your arm. Okay, talikod, talikod. Talikod. Then, tingnan ko if sakit, okay? Okay? Put it on your head. Again, do it on your arm. Put it on your head. Very good. In the other side. Do it, put it on your head. Again, do it again. And again. Sige, put it on your head. Okay, now let's go to external rotation, sir. Dari. Put like this. What am I doing? Very good. Up, up, up. And down. Pa-down ang... Okay, very good. Sakit. On the other side. Pensa, tarong, tarong. Stand straight. Posture straight. Okay. And down, down. Okay, very good. The next thing that we will be doing, sir, is that we will be down to your elbow na. Okay, would that be okay with you? If manaog na ta sa imong elbow, like do it in a dumbbell position, like mura kag aswat og dumbbell. That is, you have to do flexion and extension. Okay, so let's flex. Dungan ta, 3, 2, 1, go. Sakit?
Wala.
Extension, down. Again. Again. Very good. So, walay sakit ato, sir, nga motion nga atong gihimo. So, full range of motion again for our patient. The next thing that we will be doing is the forearm. So, we will be doing supination and pronation, sir. Katong ana, supination and pronation like atong gibuhat kanina. Okay, so pronation, close your straight, straight, and supination. Pronation, supination, again, pronation, supination. Are you experiencing any pain?
Wala.
Okay, very good. So, your wrist joint is normal. Next, sir, we will be moving to your wrist. So, do it like this. Murag bayot, sir, nga position. Kana, pangusog, pangusog. Straight. And do it like that. Straight, like this. Like this. Here. Okay? You have to do flexion, down, ana. Straight, down, ana, ana. Okay, and extend up, hyperflex. Again, flex down, extend, hyperflex. Very good. Next thing, sir, that we will be doing for your wrist is your abduction and adduction. We will be using your ulnar and radial. So, follow me. Okay ra? Follow. So, ana, para dili ka maglibot. Okay? Follow. So, we will be starting with your left arm. Dali tao na, ha? So, let's do the ulnar. Okay? Drift to the side. Again. Drift to the side. Again. Drift to the side. Now, we will be here in our radial. 3, 2, 1, go. Sakit? Nakay sakit nga na-feel? Wala. Okay, in your right arm, we will be doing the radial. Sakit? Nakay sakit diri nga na-feel nga joint? Again. Okay, on the other side, ulnar. Wala. Wala yung sakit nga na-feel. Very good. Now, sir, we will be moving to your fingers and thumbs. Would that be okay with you? So, fingers and thumb. For your fingers, sir, we have to do this individually. For this is our flexion, extension, and hyperflexion. See? This is your flexion, extension, hyperflexion. Okay, can you do it? Flexion, extension, hyperflexion. Do it on your 4 fingers. Do it like this. Okay, flexion, extension, hyperflexion. Here, flexion, extension, hyperflexion. Very good. Now, let's move to your thumb. So, here is your thumb. Diba? Sakto, sir? Dili.
Sakto.
Sakto. So, for the flexion, we have to do it in this manner. Flexion. Very good. Nakuha. Again, we will be doing flexion. 3, 2, 1, go flex. Okay. For extension, we have to go back. Flexion. Extension. Okay, do it in this manner. 3, 2, 1, flexion. Extension. Flexion. Extension. Next, sir, opposition. So, we will be using the thumb finger opposition. You know how to do that? Okay. Wala difficulties? Dili sakit? Faster? Can you do it faster? Pas-pas? Okay. So, there is full range of motion again. And the next thing is that I will be assessing your or doing range of motion to your hips and to your knees and to your ankles, okay? So can you please lie down in our bed? In your bed, I mean. So for your hips, the first thing that we will be doing, sir, is flexion, abduction, and adduction. So when you flex, you put your hips or this area in your chest. Okay? 3, 2, 1, lift. Lift. Piko, piko, lift. Okay? Do it again. Do it again. Ina ko if na kayo ma-feel na sakit. Okay? 3, 2, 1, lift. Very good. On the other side. 3, 2, 1, lift. Butang force. Nakay sakit na ma-feel. Palpate. Nakay sakit ma-feel. Okay, very good. Now we will be doing abduction. So when we say abduction, turn it outside, outwards. Ana, okay? Do it on your own. And when we say adduction, sir, abduction, adduction. So I will be, ana, adduction ha? Okay, so do abduction. Abduction, sir ha? 3, 2, 1, go. Sakit? Wala. Again, 3, 2, 1, go. Okay, sakit nga na feel? Very good. And adduction. Again, do abduction. Sakit? Adduction, palusot diri sa lalong. Sakit? Again. So, we will be now moving here sa imong pika side. Okay? You have to do first abduction side. Tarong ng body. Ang tiil lang ang mulihok. 3, 2, 1. Do it on your own. 3, 2, 1, go. Abduct and adduct. Palusot diri sa lalong. 3, 2, 1, go. Okay? Sakit? Wala. The next thing that we will be doing, sir, is internal rotation and external rotation. So, to do that, you have to put your hips on 90-degree angle, okay? 90-degree angle. So, let's start with internal rotation. 90-degree angle, and your ankle shall be placing outwards. So, like that. Okay? You know how to do that on your own. Again, 90-degree angle, and your ankles outward, and ankles on the other side. Okay? Do it on your own. 90-degree angle, outward, the other side. Sakit? Wala. The other side na punta. So, 90-degree angle. Then, outward ankle, inward ankle. Nakaka-feel nga sakit? Sure? Mawala? Now, I will be moving to your ankle, sir. Okay? For your ankle, we will be doing dorsiflexion. So, I will be pushing here. Can you do that on your own? Dorsiflexion. 3, 2, 1, go. Do it again. Again, 3, 2, 1, go. Very good. Now we will be using what we call plantar flexion. Okay? So this is dorsal flexion and plantar flexion. Do it on your own. Dorsal, plantar. Very good. The next thing that we will be doing is inversion and eversion. Okay? So when we say inversion, pasulod. Pasulod. Okay? Pasulod, and this is your eversion. Do it on your own. Pasulod, pagawas, gawas, again, pasulod, and pagawas. Okay. The next thing that I will be doing, sir, is we will be going back to your hips. So, pwede kang mo ubo, dorsal position. Very good. We will be extending your hips if you can. So, can you extend your hips here? This side, do it in this manner. Ana, straight lang. Okay, 3, 2, 1, go. Go. Sakit?
Wala.
Again. Okay, very good. On the other side. Lift it as far as you can. Very good. Again. Again. Very good. Now, let's move to your knees. So, fold your knees. 3, 2, 1, go. Sakit? Dari nga area.
Wala man.
Okay, on the other side. Other side. Wala?
Wala.
Okay. Thank you so much, sir. Please go back to another position, to your position. Okay. Now, I will be testing for muscle resistance, if that's okay with you, sir. Okay, Ra? So, please stand up. I will be checking for muscle resistance. Okay. So, you have to flex your arm. Flex your arm. And I will be pushing you. Okay? 3, 2, 1. Again, down. Flex your arm. Musog. Okay, then try pulling my arm. Bira akong kamot kung kaya nimo mangusog. 3, 2, 1, go. Again. Again. 3, 2, 1, go. Very good. Again, lie in a position, sir. I will be checking for your muscle resistance in your ankle. Okay? Pangusog ha. Pangusog. 3, 2, 1. Again. 3, 2, 1. Again. Okay ra? Again. Very good. Now, the last thing that I will be doing, sir, is that I will be checking for your babinski reflex. Okay? Tell me if gilok or dili. Okay? 3, 2, 1. Go. Wala, gilok, gilok.
Gilok man.
Again. 3, 2, 1. 3, the other side. Again. 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 Okay. So our findings for the reflex is that is positive too, because there is muscle twitching. So gigilukan natong patient, that is considered normal. For the muscle strength, our patient was able to resist the force that I was able to give to him. And the score of that is 5, because there is full range of motion and there is also full resistance. As of our patient's range of motion, all of the joints from the neck, going to the shoulders, to the forearm, to the wrist, and to the fingers and thumb, to the hips and to the ankle, is having a full range of motion. And our findings for our patient's posture is normal and erect. For our patient's gait is legs and arms are well coordinated. For our patient's cerebral function is that movements are coordinated from all the activities that I was able to give to him. And for the questions is that our patient is quite young, so he doesn't have any injuries being experienced, and he also is not immunized with anti-tetanus and anti-polio. So it is very important, sir, again, to be immunized with anti-tetanus and anti-polio, because it will be preventing you to experience musculoskeletal dysfunction. Okay? Gets ra? And when you do your exercise again, you have to wear proper equipments like shoes and your knee pads. Okay? And our patient's gait is stable. He does not need any help for support. No ambulation needed. Our patients, there is no involuntary movement, no fasciculations, that's the term. The skin is intact, no lesions, no masses, no nodules, and there is no pain in any point that I palpated in my patient's muscles and joint. There is also muscle strength, again, that is 5/5. Reflex is positive too, as I did babinski reflex. And my patient's muscle tone is normal. It is not hypotonic, it is not hypertonic. So that's my findings, and I will be doing my hand washing for infection control, and that's the end of my musculoskeletal assessment to my patient. Thank you so much, guys, for watching, and good night. Thank you.